Hello and welcome to About the House. With 1 in 20 Australians living with diabetes, it has become one of Australia's leading chronic health conditions. The House Health Committee has commenced an inquiry into diabetes in Australia, and we caught up with the committee to find out more.
Well, we're very pleased, the Standing Committee on Health, Aged Care and Sport, to be asked by the Health Minister to commence an inquiry into diabetes, type 1 and type 2, and obesity. The relationship between obesity and type 2 diabetes is complex, and we certainly want to look at that relationship and whether there is a way that we can, in type 1 diabetes, predict people who are at risk of type 1 diabetes and prevent type 1 diabetes, as well as all the new treatments that are now becoming available and the best plan forward for type 1 diabetes. With type 2 diabetes, we are looking at, again, the social factors involved and what can be done to try and reduce our very high incidence of type 2 diabetes with an ageing population and increased risk of obesity, and what are the broader factors involved.
As well as the medical issues, the committee wants to delve into the social and other effects of the condition also.
We have type 2 diabetes, which impacts, I think, all of our communities. I know that in my electorate we have one of the highest rates of type 2 diabetes and obesity in the state of New South Wales. And then type 1, which is very different to type 2, it's an autoimmune disease, and I've been personally impacted with my son Byron getting type 1 after contracting COVID, and our previous inquiry into long COVID showed more evidence coming through about the relationship between COVID and type 1. So again, we have a really important inquiry.
Type 2 diabetes has traditionally been a disease of older people, but in the last decade or two, as paediatricians, we've been seeing a really concerning increase in the incidence of type 2 diabetes in Australian children. That's something we need to look at. But the other thing we'll be looking at as a committee is gestational diabetes, and we know that that's particularly on the rise in First Nations communities. So I think it's really important that as a committee we get around Australia and speak to all of communities from a whole lot of socio-economic and different ethnic and racial backgrounds, people from all parts of Australia, to hear about their experience with this really concerning condition.
My electorate of Dunkley has quite a high rate of diabetes, and as a non-doctor, one of the things we're really interested in is those social causes and what we can do more broadly: town planning, sport and activity in schools, education programs, to help to address type 2 and other types of diabetes that have a real link to social and economic status of people.
The committee wants to hear from a wide range of people, from those affected to experts in the field.
We want lived experience, so people who have diabetes, both type 1 and type 2, and people who've had gestational diabetes. All the major interest groups, doctors groups, dietitians, town planners, people involved in the food industry. Researchers. But we also want to try and get around the country to hear from as many different communities as possible. So really a very broad inquiry. It's not going to be a few weeks, it's going to be a long-term inquiry, and we want to get as much information as we can so we can look at a plan for the future.
Thanks for watching. To find out more about the inquiry or to get involved, visit aph.gov.au/diabetes in Australia.